Good evening. It is an incredible podcast plan for us tonight, and it's so appropriate. Uh, I have been personally out walking for probably 3 to 4 times more than I've walked in a long time, and I have some knee pain, so it's a great topic for tonight. But more importantly, I have been just bombarded with news articles on the growing epidemic of mental health issues, chronic disease, the rise in everything from diabetes to autoimmune disease. It is really an ugly world out there, fueled by two horrible things: stress and fear. In order to really lay the groundwork for this 33rd Rethink Your Health podcast, I really want you all to take a moment and think about 5 years ago. That would have been what? 2017? 2017. And think about what you were working on, where you worked, what your children were doing, the vacations you were planning in the summer, the family visits you had, the way you felt health-wise and in your body. And I want you to compare it to where we are in the world of 2022. And I want you to notice as you begin thinking about the comparison, how your body reacts. For me, right away, I felt a tightening in my shoulders and a little bit of discomfort in my belly. And that, my friends, is the topic of tonight's podcast. How, when we think of things, how, when we use our brain, we actually create physical sensations, diseases, and problems in our body, which is now more and more proven and demonstrated by neuroscience, psychoneuroimmunology, and an entire branch of science called somatics that studies thinking and its impact on our health and our body. Tonight, we spend an hour with an extraordinary neuroscientist, colleague, friend, writer, speaker, and researcher. Her name is Dr. Alba Rodriguez, and I'm going to let her give a little bit of background on herself and how she became interested in the study of pain and stress resolution, and her own background, which is really populated with amazing awards, scientific studies, running an integrated health institute at Henry Ford Health System in Detroit. I mean, an amazing array of truly professional achievements. At this point in her life, she is dedicated to going grassroots for all of us, to bring us all to a point where we are able to control and resolve pain, reduce stress with our mind, and micro exercises of our body to have us feeling our most joyful and our less painful selves in a lifetime. So, Dr. Alba Rodriguez, let me bring you up on the screen. Welcome, welcome, welcome.
Hello, Tanya. Thank you so much for having me and for that wonderful introduction. I was so excited just to hear what I'm going to say because it's such a great introduction.
Well, good. Well, can you do us a big favor and talk a little bit about where, your credentials, right? How you've come to us and how you've gotten interest. It's not every girl that gets interested in neuroscience. I mean, that's a really specific field, Alba. And to get a PhD in an obtuse field takes a lot of thought and takes a lot of interest. Can you talk a little bit about why you're a neuroscientist?
Sure. When I was in college, I took my first, I was undecided major and I took my first psychology class. And I thought, wow, this is the coolest thing ever. How your mind influences everything, right? The study of behavior, the study of the mind. And then when I went to graduate school, I took a some classes in neuroscience and how it relates to psychology. So it was actually I ended up doing a PhD in psychology with a focus in cognitive and neural sciences. And it was so exciting because to know how your brain works and how that ties into how your body works and how they both affect each other was just really exciting to me. And I had the great fortune to work with a lot of great researchers. And some of my work there at USF, University of South Florida, here in Florida, was directly looking at different diseases of the brain, things like Alzheimer's, Parkinson's disease, Huntington's disease, and what can we do for treatments for these neurological disorders that are so affect people's not only their minds, not only their brains, but their bodies as well. So that's where I started out. And that was at the University of South Florida. And then when I graduated, I got the opportunity to go after my doctorate to do a postdoctoral work in Michigan at a hospital system that was going to be starting an integrative medicine center. And I thought that was so exciting because I had done a lot of work, preclinical work, for those of you who don't know what that is, that means we're working with animals, hoping that what we do in that research and what we learn and the treatments we come up with will, in the future, maybe one day, someday, 10, 15 years from then, help people. But what I really was excited about was how can we really impact people now? How can we help them with the problems that they have now? And so that's why I went to work in a postdoctoral field where I continued the neuroscience research, but also started working in integrative medicine and working with clinical populations, doing clinical trials.
Wow. All right. So I want to go back to how pain is related to neuroscience. What is the origin of the pain that we feel in our bodies at its most simple?
Well, I'm going to tell you something that's kind of, you might think, well, that just sounds weird. That sounds like odd, but a lot of pain, especially chronic pain, has to do not with necessarily the injury that we had, although obviously injury causes pain, but what happens, our bodies and our brains reaction to that injury or that stressor. So any stressor, whether it be a physical stressor. So for example, when I was 19, I got crushed between two semi trucks, right? Big physical stressor, lots of broken things, lots of surgeries, lots of things going on. That is a physical stressor. But there are also emotional, psychological stressors. Those of you who have been through the last 2 years know what I'm talking about, right? All the stress that we've experienced on a daily basis. Oh no, we're all going to die, kind of stress. Every moment on television, the news telling you all the people that died and the countdown, and all of these things cause our bodies to react in a stress response. And you may have heard of the stress response, right? How many of you have heard of fight, flight, or freeze? Right? Mm-hmm. That's the stress reflex or the stress response. So the interesting thing is when that stress response isn't resolved like it should be, like, we're made to, oh no, there's a lion coming after us, take off running, right? That's a stress response, the flight or attack, fight, But in our lives, we have all these chronic stressors that just go on, the deadlines and the, stressful work and the stressful family life. Those things go on. And how does our body react? So what happens in fight or flight? Tanya, you just mentioned one of the things. One of the things that happens is our muscles tense up. They got to get ready to run or they got to be ready to fight. So a lot of muscle tension occurs. And now what happens when you're stressed day after day after day? You start getting what's called a habituated stress response. And what that means is just that stress response, that muscle tension in your body, along with all the other things that go along with it, is kind of stuck on. It's become a reflex, and you're no longer even kind of aware of it. I mean, it's there on a subconscious level because you feel tight, right? You feel your neck, your shoulders up around your neck, Tanya. When I first met you, you had some really terrible neck pain and you could barely move your head.
Yes.
And that was that stress, which is tightening up those muscles and causing them to be on all the time. So imagine those of you out there watching today, and actually do this with me, Tanya and everybody else. Hold your hand up like this and hold it in a fist, right? Now hold that fist really, 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 really hard. Now, after just a few seconds, what do you notice?
It just hurts, pain.
Yeah, it starts to hurt already, right? We all know a muscle in spasm, a muscle that's tight, that's activated. Like, how many of you have ever had a Charlie horse? It just starts to hurt, right?
Oh my gosh.
Yeah. So how can we release that pain? Well, what if we could just let go of the muscle tension? Okay. So one way to do that, one way to get rid of that pain is to learn to train your brain to get out of that reflex mode and retrain your brain to take control of those muscles again. So you're the one in control of those muscles. They're not just like on all the time.
Mm-hmm. All right. Now you sent me an amazing PowerPoint, and I want to bring up some of the slides because I just think if we just have everybody stop for a moment and say, stress is pain and pain is stress. There is an undeniable link between what the brain thinks and what the body feels, right?
Mm-hmm.
And so this is what I've learned so far in 10 minutes. So there are two sources or roots of the pain that we experience. One is physical. As I said in the beginning, we walked 4 miles, in the hot sun in a single day. So my right knee that usually behaves has some pain in it. That is a physical stressor, right? The emotional stressor that may contribute to that is my thinking, oh my gosh, this leg is going to get worse. I'm getting old. Osteoarthritis is a horrible thing. And those negative thoughts also are a source of stress, which exacerbate the pain. Correct?
Yes. And it's not so much the stressor, because you can have something that somebody else would consider to be a stressor, right? Mm-hmm. Like, let's say you and I both win a trip to Hawaii, right? Mm-hmm. And I'm excited. I'm ready to go. And you're like, oh my gosh, what if, and not you personally, but what if you were afraid to fly? Mm-hmm. Now, all of a sudden, that thing that's a stress, that has become a stressor for you, right? Because you're worried about, oh no, what's going to happen? I'm going to be on a plane for, 10 hours to Hawaii or however long a flight is to Hawaii. And that's stressing you out. To somebody else, that might not be a stressor. For the people on the stock market floor, for them, that's not a stressor. For anybody else, they'd be freaking out with all the noise and all the stuff going on. So it's not the actual stressor, but it's more your reaction, your response to that stressor. But the great thing about that is, because it's not just that there's a stressor out there, but it's how you respond to it. You can learn and train yourself, train your brain, and train your body how to intervene at that level of the stress response so that it's no longer having that negative effect on your body.
Wow. I put up something that you have in this PowerPoint from Science Daily that I think is important for everyone watching and listening to hear. Can you talk a little bit about this Mayo Clinic research?
Yeah, this was an article that's posted on Science Daily, but you can also find the original study. It's called The Have-Nots, and Knots is spelled K-N-O-T-S, but it's called The Role of Stress in Everything. And this is an older study, but everything in there still applies. But basically, it's saying what we're saying, that the fight or flight response, it occurs automatically, right? It just happens. You can't really stop it from happening. It's basic to our survival. And it's important. It's necessary. You need that. It's actually a great thing. The problem is that we have all these stressors that just go on and on and on and on, and we don't get the resolution. Right, like COVID. We don't get the resolution. And when that goes on, that can cause so many ill health effects, such as digestive difficulties, because your body pulls the blood away from the stomach and to your arms and legs so you can fight. So guess what happens when you're on that stress response all the time. You've got that going on all the time. What's happening to your digestion, right? What's happening when it's not working properly and you're having problems all the time? Now you've got GERD, now you've got acid reflux, now you've got all these issues going on. So there's many issues, and some estimates say that up to 90% of what people seek healthcare for could be related to stress. So either stress directly causes it, or it aggravates it, or what you're doing causes you stress. And like you were saying, a lot of us feel that stress in our neck, in our shoulders, in our back. Some of us feel it in our jaws, right? So it causes not only all of those stress-related diseases, stress-related conditions, but what we don't often think of as a stress-related condition, which is the next slide that you have right there, which I love this slide, which is pain. And you know, when is the last time, those of us who are getting a little bit older here, I'm nearly 26 now, so you can imagine that you go to your doctor and the doctor says, "Oh, doc, my right knee hurts." And he says, "Well, you are getting older," right? And your next thought should be, well, how old is my other knee? If my other knee doesn't hurt the same, then something's going on besides just age. It's not the age that causes the pathology. What causes the pathology is your response, your body and brain's response to these stressors. Okay, like here's just some examples. The stress up there in the right-hand corner is that physical, like we talked about, injury or misuse. How many of you type all day long and you've got carpal tunnel, or you've got whatever it is, or it's a psychological stressor, an emotional stressor. Those cause that muscular armoring, the muscle tension, the protection, the stress response, and other expressions of the stress response, which, heart rate increases. So what happens when your heart rate's up? What happens when your blood pressure increases for fight or flight? And you're like that all the time, or let's say most of the time, right? Your brain also responds to these environmental things and regulates these neuromuscular responses. So the great thing is that we as human beings, we have the ability to, one, change how we look at stressors. So it's not really, like we said, it's not really that there's a stressor out there, but one, it's how we interpret the stressor, and two, how we react to the stressor. And so, although some of these things are automatic, we can learn, we can train our brains to go, hey, wait a minute, I don't need to be like this with my shoulders around my neck, causing my shoulders and neck pain because they're tight all the time. I can learn how to get my brain to go, oh, wow, that's much better. That feels better. It doesn't hurt. So those are kinds of the types of things that we talk about. And interestingly enough, there was a study that came out. They used to tell you, oh, well, you have pain because you're pinching a muscle. You're pinching a nerve or something like that, right? But there was a study that came out that said chronic muscular pain may be linked to a previously unknown principle for how pain signals are transmitted. These muscles, and you might have remembered these from biology long time ago, there's these cells and these little sensory cells in the muscles called muscle spindles. And their task, their job, is to tell the brain of changes in the muscle length. But what the studies showed was that the muscle spindles, they also contain pain receptors. So when a muscle is damaged as a result of overloading, let's say you bend over to pick a 200-pound thing up off the floor and you throw out your back, right? Overloading, or damage to this with chronic low-grade overloading, right? So it's not one time that you went like that, but it's that you're just on all the time. Mm-hmm. Those cells themselves, just that tightness of the muscle can cause pain. So that's why we said, if you're holding your hand like this for an hour and it really hurts, when you first relax it and go to open, it's kind of stiff and it's sore, but after a few minutes, that pain starts to go away. So we can learn how to get other muscles in our bodies, like our neck muscles, our shoulder muscles, our back muscles. How many of you clench your jaw when you're stressed? Anybody? We had some responses there. Those of you who clench your jaw, you're probably hurting all the time. And what do you notice? That it's worse when you're stressed than when you're not stressed, right? Nobody goes, oh, I'm so stressed. Nah, you're like, oh, I'm stressed. Like Kramer would say, I'm stressed, right? So how do we intervene at that level? Because we know how much damage stress causes us, and even more so that unrelenting kind of stress, either caused by an outside force or caused by our own thoughts. I like to think of this quote is often attributed to Mark Twain. He said, I've suffered a great many terrible things in my life, and some of them have actually happened.
Exactly. The suffering is in the mind, never in reality, or rarely in
Right,
reality.
right. So
All right,
we suffer
I have a
about stuff.
very just we treat. All right, when I go to the doctor and say I have a pain in my body, they give me anti-inflammatories.
Mm-hmm.
And how do they work?
Well, that's a good point. I'm not sure anybody knows 100%, exactly what they do. That's the problem. You get these medications and they're supposed to be, so for example, you might get a muscle relaxant, but there's not really any such thing as a muscle relaxant. What there are, they're mostly sedatives. They, take you down, right? Try to get your whole, sedate you so that you're not as wound up. But same
So
thing
your
with
brain
the,
doesn't process the pain. Is that how it disconnects the pain from the brain?
well, not exactly. Again, they don't really know how they work. Yeah. So, but the problem with all these medications, so even if you do get some relief in the short term, and there's a study that just came out not too long ago showing that people who have injuries and then they take medications like anti-inflammatories end up with more risk of chronic pain than people who don't. So it makes you want to kind of rethink, well, what do you do? I just twisted my ankle. Do I pop a pill, right? Do I take an ibuprofen, or do I take some other kind of medication? So what are things to consider? One, what types of side effects do these medications have in the short term? Like, people think, oh, Tylenol, yeah, Tylenol's not going to hurt you. But guess what? You can OD very easily on Tylenol and end up with severe liver damage, right? Or we think about, like I just told you, what are the, not only the short-term effects, but what are the long-term effects? Is it that if I take this anti-inflammatory, am I going to end up with an increased risk of chronic pain? So what do we do to treat an injury so that it doesn't lead to chronic pain? And what do we do when we've already got chronic pain so that we can reverse that, turn that around and go back to
and that's where your somatic functional therapy comes in. It's a science and an approach to non-medicine intervention, but somatics with the mind. And I'm going to pop on your PowerPoint again, because I think there's some a really interesting approach. Let me see, where am I here? And there we go. So in order to break this cycle, you have something that you have developed over a couple of decades that's actually won an award in 2011. Can you tell us about that award before we even talk about this?
Okay. Yeah, I need to correct you a little. It wasn't me that developed it, but we'll get to that.
Okay.
The award was the American Hospital Association. I presented this research at a Academy Health conference, and research that I'll tell you about briefly here in a little while. But basically, it was clinical research, clinical trials, studies that we did at Henry Ford Health System and through local community and corporations using a somatic functional therapy approach for treating for actually not treating, but actually teaching people. It's an educational therapeutic system, right? So we're retraining the brain to resolve pain and other health conditions that result from those neuropsychophysical responses to stress. Some of the things we already talked about in that stress response. So this is basically, you learn how to retrain your brain. And so this was a 10 years of research through a major health system where we taught these programs, basically self-care programs. And part of that was using mindful movements to kind of give the brain some neurofeedback, right? Some biofeedback to teach it what to do to relax that. And somebody from the American Hospital Association saw me give that lecture, and they called me and they said, wow, this is really exciting stuff. We're really interested in creating a culture of health among hospitals, right? And best practices for that. So he interviewed me, and then they posted us, there was a number of hospital systems across the country that were highlighted for creating a culture of health, best practices, right? And ours was highlighted, this program that we did was highlighted for being an outcomes-driven, research-proven group program for hospitals and employers and health plans. And they really liked that it was, research, straight up scientific, clinical, randomized trials, and all other kinds of clinical trials, and that where we were engaging with the community. So for corporations in the area, faith-based community, we did programs with churches, with our employees at the hospital, and also with participants from the health insurance company in the area. So that's what that was about.
That's certainly exciting. And as our dear friend Ralph, thank you for being here, Ralph, says, it's about retraining the brain in almost everything we do. But I would like us to have a moment where you actually, I'm gonna, I'll do my testimonial. Year and a half ago, I was a couple weeks away from surgery. I had known Alba very well. I'm a cynic of everything, but not from Alba and her partner, Ramon Nunez. I had met them to talk a little bit about publicity for somatic functional therapy in a book that they were working on or are working on. And I'm sitting at the little booth with them, and Ramon just says, look, I can go on for hours to tell you what this is and how to release micro movements in your body that will cure pain that you've had for years, but I'm going to just make it easier. Man, your left shoulder, I bet you can't even look across, to look for oncoming cars, right? And I went, well, yeah, does it? Oh my God, am I really crooked? Because I'm like so stiff. I can, I go to a chiropractor, they can't do anything. And he said, well, let's get rid of that pain, because that pain causes headaches. That pain causes anxiety. And he's going on and on. I'm like, oh my gosh, I feel like I'm a therapist, but he's so right, And so he did a series of movements. And I'm like, yeah, right, this is really going to work, And it did. I can't lie. I still get my stress in that upper neck area, especially if I'm carrying heavy things and I'm on a business trip. But now I know these movements, these very small movements, and maybe that's what we can do today, because we're right up on the screen, that I can use at any time and resolve the pain. I mean, resolve the pain. Now, that's a little mini, not so horrible, even though it was chronic and it hurt. And I actually had a very horrible lumbar disfiguration, right? It slipped and almost was against the very bone of my spine. This was about a year and a half ago, and I moved. And between moving boxes and furniture, I was immobilized. Heat, muscle relaxants, and it's hard to have muscle relaxants when you have a 10 and a 7-year-old, and you're using canes, and you're trying to pick up after your pets. It was horrible. I mean, it was like, how do I even imagine a future remotely like this? So I decided that surgery was the only option, and it was going to be 6 weeks. I didn't know how I was, I'm on my own, how I was going to manage, but I had to, because I had to get out of that pain. So I found a really good surgeon. He needed like 6 weeks. All was good. And, I then thought a little bit, what can I do in the meantime? Physical therapy, he wouldn't even let me go, because they were worried that if I was adjusted, or chiropractic, that I could really damage the nerves in my lower back. So 2 things happened. And one was I discovered antioxidants. I mean, everyone's heard of curcumin and all those things, but I discovered through a friend, muscadine grapes, 100% grape seed. And it is on the ORAC scale of antioxidant power. anti-inflammatory, just, 500 times more than the goji berry or things that you hear about all the time, blueberries. So I started taking, 6 capsules a day of that, thinking, whatever, I'll try anything. They sent it to me for free. So I said, I have to do this. And then I remember Alba, who we weren't quite as close as we are now, saying, Tanya, I sent you that lower back release series. Why don't you just pull it up and do it? And I'm like, okay. So I started doing those, and I immediately found relief so that the sciatica was not shooting pains. In 3 weeks after being on Must Natural and doing these movements, one morning I woke up and I was on my toilet, which usually took me about 10 minutes to get to in the morning. And I realized I don't remember how I got there. I didn't have to stand up and work out my back. I just went to the bathroom and I was like getting up and saying, oh my gosh, it's relieved. And I have continued on my antioxidant journey, but probably even as importantly, if not more importantly, I do a lower back release. And it is about consciously and intentionally taking those muscles, the flexors, my hips. When I'm around Dr. Nunez, he helps me with that. And to actually do movements, micro movements. It's not exercise. It's not physical therapy. It's really just micro movements to tell my brain, look, you're so scared to use these muscles, and that's causing even more pain. And it really does help. So I wanted to make sure we spend, and that really has saved my mood, saved my excitement about aging, because before then it was just inflammation, pain, osteoarthritis. It's in my family. I'm lucky to be not on a cane. My mother was on a cane at 50. My grandmother was on a cane in her 40s. So I'm like, wow, this can really help me. So I'm madly, madly committed to you, Elba, to help get this message out. So
And the great thing is you did that yourself naturally with food, right? One is grapes, and with movement. So you're retraining your brain and providing your body the food that it needs to heal on its own, instead of some kind of medication that has who knows what kind of side effects, that then you're going to need another medication to, treat that side effect, and another medication for that side effect, and so on and so on and so on.
Exactly. And I think that what's really astonishing is that my surgeon said, I walked in, I was supposed to go and get all these tests prior to the surgery. And I said, I don't know, maybe I'm crazy, but I took some grapes and I started doing some like really slow movements called Somatic Functional Therapy. And he said, and you walked in here just fine. And you just got up on my table just fine. And I said, yeah. He said, we're going to whip you over to the MRI. And he saw enough improvement. It was like a couple of centimeters that he said, if you can do this and come back to me in 6 months, you're clear. I don't want to operate on something that's resolving on its own. And I will say that again. He said, I don't want to operate on something that's resolving on its own. And guys, if you saw this MRI and this X-ray, you'd be like, how can that ever slip back into place? Now, it is not back into place. I don't know if it will ever be back into place, but the pain is not there 90% of the time.
And I'll give you a little bit more insight into that. It's not that it slipped anywhere. It's not like, oh no, there was a banana peel and your, disc slipped on it. It's not slipping. It's being pulled out of alignment by, guess what? Your own muscles. Your own muscles are pulling it out of alignment. So when you can get your brain to go, wait a minute, these muscles down here, I noticed that they're tight, then your brain allows those muscles to relax, and then it allows it to go back where it's supposed to be. Because they're the only way it's going to move from out of where it's supposed to be is one, either if it's pushed out by like an injury, right? You get hit by a baseball bat, or if it's pulled by your own muscles. So what you're doing is saying, well, let me address the source of the problem. The source of the problem is these muscles are so tight that they have pulled this disc out of where it's supposed to be, this vertebra out of where it's supposed to be, right? And now, how do we get it back? And obviously, when it's out of where it's supposed to be, it's going to cause inflammation, it's going to cause pain, it's going to cause all kinds of problems. And so you did the right thing, is you addressed the source of those issues. And, you can continue to improve that, right? And you know that whenever it gets bad, it's probably, I'm stressed out. I've been doing something like sitting in front of a computer 20 hours a day. Not that any of us do that, right? Or we do things like that. And so we can learn to retrain our brain, which impacts our body to resolve that stress and to resolve that pain.
And, I just want to put in there, before you do a demonstration for everybody, the very important fact that, there are some people who say, Tanya, go train your core muscles. Go in there and do a really hard workout. Go build your hamstrings. And I learned from Dr. Nunez, your partner, that what you're doing is you're training your muscles to go into constriction and restriction. And the people that suffer the most chronic pain are those runners, those weightlifters that have these muscle torn threads that are in kind of constant states of retraction. Is that the best way to describe it?
Of contraction, yeah.
Contraction.
Yeah, they're just on all the time. Like, you're supposed to be on when you're lifting weights. So if you're doing a bicep curl, that muscle contracts, and it's supposed to. But if you're just sitting here and your muscle is like tight, then it's going to hurt, right? And guess what? You're not going to be able to. You're not going to have freedom of movement. When those muscles are tight, when they're contracted in this reflex, not only does it hurt, not only do those spindle cells kind of sound the alarm with pain, but it's also stiff. It's also uncomfortable. You lose that range of motion that you had.
That's what happens. I'm in Florida, and every time I go into a diner, I go, oh my gosh, posture, don't be stiff. Make sure you keep doing the SFT movements, because you don't want to end up bent over, almost touching the floor in a walker. Because I don't think that's genetic. I think that part of it is it just starts happening, and your mind gets as oppressive as the pain.
Right. It's a functional problem that becomes a physical problem, right? It becomes structural, but it starts out as a functional problem. It's interesting because we've had people that are really hunched over like that, where you can see, how hunched they are. And after 5 minutes, they're standing 2 inches taller, just from learning how to release those muscles. It's not that they have weak
learning with you, Dr. Alba. Let's do some learning. I put Dr. Alba's and Dr. Nunez's website up, and you can subscribe to notifications and things like that. And then I also wanted to put up, before we get the demonstration, the Dr. Alba's email address. They are preparing actually a training program for those of us that are helping people, whether we are nurses, doctors, massage therapists, mental health counselors, all of those things, pulling a training together to have somatic functional therapy certification, so that you can help people who are experiencing chronic stress and strain that's turning into unmanageable pain. I love how all those words rhyme. But to learn how to not only do that for yourself, but to help others with it. So if you want to be one of the very first invited, and I can tell you right now, because I'm helping with the promotion, it'll be 50% off if you listen to this and send her an email to come to. It'll be an online training, and then some of the more technical things will be in person. But it is the most amazing practice, and I'm going to ask you, Alba, I'm going to get off the screen and ask you to lead us through one that will provide immediate stress and stiffness and pain relief.
Sure. Let me just say one thing before we get to that. When you go on that website, you'll see something about webinars for nurses. You can click on that and go ahead and register and just put in there. There's an option to say if you're a nurse or a doctor or something else. But go ahead and put your information in on that section, because that will let us know that you're interested in the webinars. Okay. And so everybody, let's sit up straight in our seats, and you might want to sit forward a little bit so that your back's not against the seat, and put your feet flat on the floor. And the first thing we're going to do one, because I'm a researcher, but two, because I want you to notice the difference, is we're going to do a pre-test. We're going to check our pain and range of motion looking to both sides. So as you sit here, just turn your head as far as you can, comfortably to your left, and then as far as you can, comfortably to your right. And notice which one of them feels tighter, which one of them feels more pain, stiffer, which one is easier to do. Just notice that. It's like a little pre-test, okay? And then I just want you to follow along with me as we do these movements, okay? So just listen to me and follow along. Now, I'm a little confused as to what's right and left on the screen because of the cameras, and sometimes they invert it. So everybody just turn to the right. And if you're looking at me and it looks like I'm turning the wrong way, just ignore that, okay? So we're all going to turn to the right together. So the first thing we're going to do is just take a deep breath. Inhale and exhale. Now, in the next inhale, you're going to move your eyes to the right, like you're going to look to the right. Inhale, move your eyes to the right. Exhale, move them back to center. Do that again. Move your eyes to the right. Exhale, back to center. And now as you move your eyes to the right, you're going to move your head just like an inch to the right as you exhale. So you're going to turn like this. And then exhale and come back to the neutral central position. Inhale, move your eyes and your head a little tiny bit more. Exhale, come back to that neutral center position. Again, turn your eyes and your head to the right, just another inch. And exhale, back to center. Again, turn eyes, head a little bit further. Exhale, back to center. As you inhale, turn your eyes and your head gently, easily. As you exhale, back to the center. Now we're going to do the same thing, but as you turn your head and inhale, also turn your right shoulder. So bring your right shoulder back a little bit. Exhale, come back to center. Do that again, a little bit further. And as you do, allow your right hand to move up your leg so you can turn a little more. Exhale, back to center. So both your hands are in your lap. As you turn with your eyes, your head, bring your shoulder back, allow your arm to come back, and your left hand to go forward, your left shoulder forward, back to center. Let's do that one more time. Inhale, turn all the way as far as you can, comfortably, without pain, and back to center. Okay, now we're going to test. Tanya, do you want to be up on the screen for your test, or do you want me to do the test without you?
I'm here.
Okay, so now let's all turn to the right and notice how that feels, the way you were just turning. And now turn to the left.
Cool.
What do you notice?
Oh my God, it feels like there's a cord that's stuck here now. And before it was my right that hurt more, and I had pain. Now I can do this easily, but when I do this hurts right here, like there's something that's really sore.
So what you've done is you've released the muscles on your right side, right? We've taught our brain, let's do these gentle movements that allows your brain to go, oh, wait, that's not so bad. Okay, I can relax. Because what happens when something hurts? What do? We tense up, we guard, right? We get more stiff, we get more muscle tension. So when your brain goes, oh, that's not so bad. Oh, I can let that relax. So now those muscles on the right are way more relaxed. So guess what we would do next?
The left side.
The left side, right? Because we want the left side to feel good too. But how long did that take us to do that?
3 minutes.
3 minutes. You think you could do that every morning to start out the
It's
day?
like mindful meditation. I mean, that's the really cool thing. Like, part of the reason that I was so resistant to doing this is because, oh my God, it takes time. And then I realized, oh, wait a second, I can substitute this for my mindful meditation. It's actually time efficient.
Well,
and it actually helps me more.
Yeah, it's a very targeted, mindful movement. So it's active meditation rather than passive. And what I was going to tell you, everybody, a few minutes ago, the person who actually developed this system is Dr. Nunez. He's been treating patients, probably treated about 50,000 patients. specifically, most of them with pain and stress-related conditions. And he's developed this system over time, due to his knowledge in anatomy and physiology, Eastern medicine. So he's a doctor of acupuncture and traditional medicine, but also movement. He's a 10th degree martial artist. So he learned traumatology, which is what, they do in martial arts. If you're injured, you got to know what to do right away. You can't say, oh, I just hurt my knee. Wait, let's stop the fight while I go attend to my knee. No, if somebody's attacking you, you've got to be able to react in the moment. Mm-hmm. And you not have to know how to address these things. So a lot of that went into developing this system. It's a system of really mind-body medicine and active meditation. And one of the interesting things he told me is that he had some of these gurus, that just sit and meditate all day long. And one of them came to see him, and he did some somatics with him. And the person told him, he said, you know what? I've been meditating for 20 years, and I got further in these 10 minutes here with you in that meditation that I have in years, because you can get to that meditative state much quicker when you coordinate your breathing, your brain, your movements, and your mind, instead of just sitting there and breathing, right? Trying to clear your mind, trying to clear your mind.
That's really cool. And I remember Dr. Nunez was telling me once, and I use this daily, and I'm going to share this with the people on the phone. On the phone, oh my gosh, this is like it's old school. Oh, yes, we're on a phone conference that are listening and watching. But, I have intermittent knee pain, right? And sometimes it's worse than others, but it can be really bad in like rainy weather or damp weather. But especially if I'm doing something like when it was really obvious is when I was trying to get on a camel, right? Because I know maybe most people
I think
don't.
we go through every day, trying to get on a camel.
Okay, all right, we'll make this better. I have a really deep hot tub. And on days that it hurts, I like to go out and be in a mineral soak in the hot tub. And on some days it hurts, and I try to get out, and I want to be graceful, because it's not like I have people in my backyard, but sometimes the kids are there and they'll laugh. They'll say, "You can't get out of the hot tub." So I have called on Dr. Nunez's recommendation to always move from my center and to be very mindful that I have a strong center and it keeps me standing. And so I have this kind of cord that can lift me here, and I have this strength throughout my central belly and abdomen and lower abdomen. And as I'm getting out, I say to myself, pull the strength from there and your knees won't hurt. And I will tell you that the pain is so nominal that I actually look normal when I'm getting out of the hot tub or getting on a camel. And so or just getting off of a chair with knee and hip pain.
And that's one of the things that we've taught in these programs is how to get in and out of a chair without knee pain or back pain, how to do it in a way where you don't have that knee pain and that back pain, like Tom is saying.
And as soon as you can begin doing this, I don't care if you're 35 years old, as soon as you can begin learning how to get your muscles that are tense from the stress, from crying, from worrying, from having the weight of the world on your shoulders, as soon as you can learn to, I have to do my left shoulder, as soon as you can learn to tell your brain, one baby step, sweetie, one baby step, and it's all going to go back to okay. Sooner in life that you can learn that, the longer you'll be climbing up hills carrying water. One of my favorite things is there was a woman I saw in Haiti, the island of Haiti, who had documentation, but she was 105 years old. Wow. And every day, and she was all, skin and knobby bones, and dressed and had such an erect posture. I was jealous, and had pressed and beautiful clothes. But one of her activities that she did was to go down to the well, to the stream, to get clean water, and to carry it at least 3/4 of a mile up very steep terrain. And it dawned on me that woman had been doing that and had learned to override, reboot any pain, any natural arthritic pain in that body, just through mindful movement. And the sooner we can learn how to do that, the more joyful and painless our lives will be.
Absolutely.
Well, I want to thank you, and we will have Dr. Nunez on as well, because he
Oh,
is.
and Tanya, before we go, I want to ask everybody that participated with us in the head rotation series, send me an email. Let me know what you experienced, because I'd love to hear from you.
Yeah, I'm going to put your email up one more time. There it is. Also, if you have any interest in the Must Natural product that I described, I do retail it. It's the most amazing product I've ever had in my life, and it has really been a joy to share it with people. And I am happy to actually sell it to you at cost, because what ends up happening is it pays it forward. I had someone who I hadn't seen in about 6 months, who had bought 20 bottles from me, had said that half of those bottles changed people's lives. And they're not, it's a dude, right? They're not like into big, thing. And it was a lot of male friends with prostate was a big one, right? And they're in their 50s. So believe in the power of food as medicine, and then know that your body wants to move in harmony and doesn't want to be in pain. It just simply doesn't. So Dr. Albita, you are phenomenal. Please, those that are watching this live and those that will watch it again, we do have a YouTube. It's two YouTubes. One is for Muscadine Global, and the other is for Rethink Your Health, spelled UR. So if you want to go back and see some of our newer podcasts, new branding podcasts, you can do that as well. Thank you. Oh, wait, I forgot to ask my famous question.
Yes.
You ready? I know you have had an amazing amount of surgery. The accident that pinned you between two 18-wheelers would have devastated, killed, destroyed anyone's life. But you've gotten through it. I know you personally. You are one of the finest human beings I've ever had in my circle. I want to ask you this. At one point in your life, you thought good health was blank. But now you know health is blank. At one point, I thought health was blank, but now I know health is blank.
I guess at one point I thought it was just the absence of disease. And now I know that it's a way more complete resiliency of mind and body, to where you're optimally functioning, optimally experiencing, optimally feeling.
It's interesting. I like to shorten all that to wait a second. We've got a testimonial here. Let me
Oh, a testimonial. I love
look up
testimonials.
what you just said. I used to think health was the absence of disease, but now I know it is optimal resilience. It's when you're resilient and you get through things and you move and live at your optimal at that point where you are. I agree. I used to think health was perfection, being the perfect weight, having the perfect skin, all things that really don't really add up to longevity. They really add up to, superficial attempts at health. But that's beautiful. But I wanted to put a post up here from one of our viewers, Joy. She's had a crook in my neck for over a week. Just did the neck exercise and pain is gone. Oh my God.
Wow.
Thank you. And Joy, make sure you do the left, right? And
Yeah.
make sure you do it. Like I did it that one time at lunch with Alba and Ramon, and I didn't need to do it for a couple of weeks. I was weirded out by it. Like I'm driving thinking, oh my gosh, look at that. Oh my gosh, and I still have that benefit. All of
But
my brain listens. My brain is, I don't know if Ralph is still on, but my brain is highly trainable. And even at my age, usually brains stop being, cooperating. So I also think in terms of dementia and other types of things that start setting in your 60s and 50s, this kind of mindful movement helps the brain function better, helps the
and
current keep it healthy.
And if you do it every single morning when you first wake up, before you do any of your regular routine, before you get into those old patterns, reset, reboot, and do it for last thing before you go to bed, that resets and reboots so that you unwinds all that tension of the day. And if you do that every day, every morning and night, it works better and faster, and you get better and better results.
And I just want to say this, that's only one. I know of 6 little mini micro series, and I know there's more. I know there's more, but those 6 I know, and I have on my computer, for foot and ankle, for hip, for the sciatica in my back, for my shoulders, and for my neck. Those are indispensable. And I know that we're going to have a training, and I'm really excited about being a part of that class. But in the meantime, please send Alba a message. And I know she will share with you in advance of that class things that can help you with any acute and chronic pain that you're having. Am I right?
And yeah, and remember too that we love, love, love testimonials. So please send me anything. And even more important than testimonials, we've got 10 years of clinical research through a major health system with over 2,300 participants that participated in these programs. And we were getting resolution of chronic pain of 30% across the board of all conditions in those clinical trials, and 80% improved. And just think if people had actually done everything, like if they were actually, because you know how people are, they do it like Tanya, she does it one day, then she does it another day, maybe a week later, right? You didn't do it every day. What if you had done it every day, Tanya? So with that research, I'm getting on Tanya's case, but if you do this every day, and if you learn every day how to be mindful of your movements and how to be mindful of your body and of your mood and of different things, you can make amazing changes, tap into that resilience that we were all born with,
Optimally. Thank you. I love your work. I love you, Dr. Alba. Give my best to Dr. Nunez.
Thank you so much. Hopefully we can have him on one day.
Oh, absolutely. Thank you, everyone who's come back again and who leaves comments and who follows. It's the foundation for helping everyone rethink their health for a much healthier and more joyful future. Bye. See you next Tuesday. Oh, wait, I got to give a plug. It's Dr. Asham Window, an amazing naturopath from the island of Jamaica, who's going to share her recipes, her insight into, nature's pharmacy, as well as kind of some herbs from her island. She also had very late stage cancer years ago that she resisted optimally. So welcome, Dr. Asham Window, next Tuesday at 9 p.m. See you then. Have a great week, everyone.